Okay, hello, we are group 4B, and this is our IPTS project. Our group members are Allison, Annika, Alicia, Molly, Lana, and me, Catherine.
Okay, so the first thing we're going to talk about is establishing a definition of this term called radical belonging. So what we've come to as a definition is that radical belonging is the end goal of a communal experience in which collective action is taken to result in transformative change to a particular system. This collective action requires the members to dismantle unspoken norms of a system's culture, asking the questions of how these systems are shaped by white supremacy and other forms of systemic oppression, and to rebuild them in an anti-hierarchical, collaborative, culturally conscious manner. Committing to this concept of radical belonging means committing to engage all members of a system to address at face value how the system is succeeding or failing and for whom it is succeeding and failing. The goal of this rebuilding is to achieve a system in which all members are not simply noticed, accounted for, and included, but also that they belong. This is important that they're not simply fitting in, they actually belong. So for radical belonging to be achieved, each member must feel that the system was built for them just as much as it was built for anyone else. So the importance of radical belonging, specifically speaking in the context of within the healthcare team, is that each member of the healthcare team, which includes our MD and DOs, our PAs and NPs, our nurses, PTOT, social work, and lastly, and most importantly, the patient. In a system where we don't encourage radical belonging of all of these members of the system, some team members' opinions might be less valued due to systematic oppression, which leads certain groups to feel justified in thinking that they are beyond or above listening to other groups. So each of these groups has their own skills that they are experts in. So for example, physicians are experts in diagnosis and treatment. PAs and NPs, in addition to being experts in diagnosis and treatment, are also expert in care coordination between the team. Nurses are expert in the day-to-day conditions of the patient, what's happening with them at every moment of every day. PT and OT are expert in the patient's ability to participate in the treatment, and social work are expert in the patient's needs post-discharge. And then the patient is expert in all of this, in their bodies, their lives, their preferences. And in order for a team to work and in order for a team to be operating under the principle of radical belonging, it's essential that all of the members both belong and truly do believe that all other members besides themselves belong. All of the team members should be respected for the expertise they bring to the table. So for an example of what could happen in a situation where radical belonging is not a core tenet of the healthcare team, hierarchical thinking could allow certain team members to not appreciate the expert opinions of other team members. So for example, if a physician believes that they're the most important member of the healthcare team, that could lead to them not listening to or valuing the recommendations of PT or the recommendations of the nursing staff. And those people have their own skills, their own training that physicians don't receive. But hierarchical thinking could allow for the physician to not pay attention to those things. Similarly, factors such as white supremacy and classism may allow the healthcare team, aside from the patient, to sort of talk about the patient and come to these decisions about what is best for the patient without actually taking into account what the patient's input is into their own care. So without radical belonging, all of these members of the healthcare team that have their own expertise are not being valued for that and are also not being used to their fullest capacity.
So now we're going to talk about some recommendations to help for radical belonging in the healthcare. So we kind of break it down with three. So organization, team, and individual. So as an organization, we can provide interdisciplinary meetings on a regular basis. This will be able to allow staff to voice their concerns allow recommendations to be made further to benefit the hospital. Also, we need to be able to hire enough staff to provide the best care to the patients and allow the staff to be able to do their job properly throughout the day. We will also need to make sure staff are being paid to reflect their value and work. When pay is adequately increased or how it should be, that leads to better care, workers being happy about their job. This can help avoid negative attitudes, burnout, distractions in the workplace if they're being underpaid. And then also just creating an environment that employees can be their authentic selves, which makes everyone feel welcome at work, being able to lead to better teamwork and care for the patients. And then for a team, we can provide weekly meetings to recap the weeks, to discuss maybe the pros and cons and how things can be changed throughout the weeks. Making sure that all staff could be attending, hopefully every meeting, participating in the meetings. And then throughout the week, supporting each other on the long days. And then maybe as a team, they could provide like an event with food or something at the end of the week just to support each other and show the appreciation of the workers. Then for individual, just make sure everyone's mental health and well-being are being taken care of. Provide resources to allow the staff to be able to take care of that. That could be giving counseling resources, encouraging like the awareness of mental health, and just being aware of the surroundings. Also to encourage to stay active, take free time for yourself, use vacation days when needed, and know your limit. Ask for feedback from supervisor to make sure you're doing everything that you can and helping out with the team. And then lastly, just continue to support your coworkers throughout the day, because a better environment helps better care for the patients.
Since the beginning of the pandemic, healthcare workers are the ones who have always had a higher risk of contracting the virus. However, people of color working in the healthcare field were and still are at the highest risk. In St. Louis, the Black community has the highest case rates and the highest death rates due to COVID. Although vaccination rates among marginalized racial and ethnic groups are increasing in the US, many are still hesitant to go get the COVID vaccine due to a history of unethical vaccine distribution among the Black population. Access barriers such as distant vaccine sites, lack of transportation, and inflexible work hours impede the use of vaccines, especially within vulnerable communities. Some other related stressors include taking care of a child at home or taking care of a parent or a loved one who needs supervision, all while trying to work enough hours to pay bills. Our intervention, we will make sure that they are accessible to everyone, and we will provide as many resources as we can to prevent employee burnout. As mentioned before, we will have weekly meetings with all team members to discuss what is working well and what can be improved. In order to accommodate for the healthcare members who are not able to attend in-person meetings, we will have the option to join the meeting via Zoom so that everyone has the opportunity to provide their input. Working at a clinic or a hospital is a stressful environment, especially during the pandemic. This can easily lead to burnout due to overworking and mental and physical exhaustion. The resources we provide to help with mental and physical health can be accessed from home, and we will be sure that they are inclusive to people of all backgrounds. For example, we can partner with telehealth and in-person therapy companies who have employees of all races so that our team members will feel more seen and heard. We will also create a diversity, equity, and inclusion committee and organize frequent meetings where healthcare members of marginalized communities can express their feelings and concerns about the workplace.
Okay, so to kind of implement some of the recommendations that Allison talked about, I listed out some key steps that we would like to take at each level of the organization. So, and to divide them into short-term and long-term steps. So for the organization, for some short-term steps that we can take, we would want the organization to do a cost analysis to demonstrate to the administration how much money the healthcare system loses with staff shortages resulting from burnout. And instead of having to hire for temporary and contractor positions, which their wages may actually cost the hospital more money. We'd also like to schedule initial interdisciplinary meetings to establish a common goal between all the members of the healthcare team and allow members to openly voice their initial priorities and concerns. and get everybody on the same page. We'd also like to gather input from each team to establish the number of new staff needed to fill in gaps in the workload, so that staff do not experience burnout. And then along with that, establishing a budget for current staff salaries and new hires. And finally, in the short term, hire new staff to create an Office of Diversity, Equity, and Inclusion where employees can openly voice their concerns and ask for advice without judgment, creating an environment where employees can be themselves authentically. In the long term, we'd like to schedule future interdisciplinary meetings in advance to allow members to discuss and assess progress, so that the progress is a long-term solution instead of a one-time deal. We'd also like to reallocate funds as needed to hire the proper number of staff and increase salaries of current employees. And finally, assess utilization and success of the DEI office that we would like to establish early on. In terms of the team, some implementation steps we have are for the short term. We'd like to schedule brief weekly standing meetings for team members to discuss how the week went, talking about what worked and what didn't work. We'd also like to implement anonymous online survey and comment boxes so that team members who are either unable to attend weekly meetings or would like to remain anonymous can bring up their questions, comments, and concerns. And then we would plan to address all of those things at future meetings. And in the long term, we would like to acknowledge different team members from all teams each week and express appreciation and admiration for specific actions to promote teammate bonding, and then implement monthly paid employee appreciation events to facilitate teammate bonding again. And finally, at the individual level, on the short term, encouraging individuals to actively acknowledge and appreciate their teammates in ways that they would like to be appreciated. And finally, in the long term, being sure to protect your own mental health and doing activities that you enjoy so that you can show up as your best self for others, and practicing an attitude of trust, openness, and honest communication with teammates.
So in terms of the metrics for success for these suggested implemented changes that are system-wide, I think it's really important to just first lay down the foundation that we want to avoid making more work for the people that we are assessing. This definitely contributes to burnout, and I can say from experience that filling out surveys does not feel like it's making an intervention in mental health and burnout. So in my kind of brief research on assessment of burnout, I found that this burnout inventory, the MBI, was suggested several times, and it really aims to understand burnout, feelings of overexhaustion, ineffectiveness, and disengagement by healthcare staff. So like I mentioned, to avoid adding extra work, I did find there was a similar burnout index, but it was a single validated question survey that can better help to evaluate burnout for everyone. And it really just asks, based on your definition of burnout, how would you rate your level of burnout? And the answers suggested for that question will kind of discuss different energy levels, physical, emotional exhaustion, frustration, and any kind of needing help. So after making these changes that were suggested by Catherine, I think it's important to follow up on how they have affected the staff. So having team level meetings to discuss what worked and what didn't will really help us know if changes have been effective. And kind of going further and meeting as interdisciplinary teams, for example, nurses would meet together, and then a charge nurse, for example, would come and meet with an interdisciplinary team to present what changes were made and how staff felt that those changes affected their burnout. I think that would go far in kind of bringing together all of the staff in the hospital and helping us understand how the changes we make affect other groups positively or negatively as well. In a more general sense, having town halls allows for kind of more open communication, and people that feel personally affected by a specific change to voice their opinion on that change, and we can achieve the same effect of having had feedback on our changes. Some more objective measures that we could look at in terms of metrics for success would include measuring how often people are actually attending meetings, and knowing that if they're taking place, if there's place for staff to discuss their feelings about the interventions taken against the burnout. We can also, for objective measures, we can measure staff retention rates at all levels, and understand why people are leaving if they are, in order to identify trends and make changes in those ways. And the last thing is, we know that patient outcomes correlate with team effectiveness and burnout. So identifying, hopefully after interventions, identifying improved patient outcomes can really help us understand what improvements we made that were good, and can help us applaud staff for their work, which can hopefully encourage healthcare staff as well. And I think really the most important thing is just continually remeasuring and reassessing what changes we made, what's worked, what hasn't, and make appropriate adjustments to those interventions so we can continue to move forward instead of moving backwards.
All right, so I'm going to be talking about how the implementation can become sustainable. It is key to assess sustainability of these implementations of enhancing radical belonging in the healthcare setting. To summarize implementation, it is important to assess the cost of the implementation as well as the cost of not implementing a new program for radical belonging. It is important to have meetings which could help sustain teamwork and bonding, implementing interprofessional meetings which assess current problems as well as examples of good workers and good teamwork. Not only is implementing company-wide strategies important, it is also important to ensure that individual team members understand how important it is to make sure they are coming to work as their best self through self-care techniques, taking vacation days, and using honest communication with their coworkers. To further explain how implementation will affect sustainability, the interprofessional meetings are important because they can be used to assess what is going on right and what is going on wrong. This would help establish radical belonging by evaluating each individual's uniqueness and how each person's strengths can be used to the best of their ability. One aspect that seems to be commonly agreed upon that causes lack of radical belonging is staffing and not feeling like one's work matters in the healthcare setting. The cost of implementing is potentially smaller than the cost of not implementing this initiative. Lack of recognition by administration of a hospital of radical belonging can result in decreased employee morale and teamsmanship because of the lack of togetherness that people feel when radical belonging or something similar is recognized. One aspect that could be implemented would be the discussion on mental health and maybe even starting a mental health monthly stipend for each employee. This stipend could be used by employees to maintain their mental health, whether they use it to go get a massage or therapy or whatnot. Implementing changes for employee mental health could help with the sustainability of radical belonging at most institutions. Implementation without sustainability is not worth anything, though. One thing that might help with sustainability would be to make the accountability of implementing someone's job. It may even be worth it for large organizations to use a sustainability manager who would take charge in assessing how the implementation is going. Engagement is necessary. It is necessary for sustainability as well. Everyone can agree that the reason actions or changes usually fail is due to the lack of initial engagement or involvement trending downward. Engagement could be measured by the amount of people that show up to the interprofessional meetings and or interact with online surveys that people fill out. If engagement seems to be lacking, using knowledge of how the organization works / what it incentivizes people could help increase engagement in sustainability and implementation efforts. Increasing staff ratios as necessary and discussed for each individual organization would definitely help sustainability of radical belonging. Increasing salaries of loyal individuals at organizations would also help people feel a sense of belonging and or wanting to belong to a specific organization.
So just some final thoughts of reflection on what doing this project has made me realize. So from the experience of this case and presentation, I've learned more about the many factors that contribute to making a system work for everyone. I've learned that effective teamwork requires all members' input to be valued equally, and that in order for this to happen, in order to get that input, all members of a team must be included in the creation of the system, and that the system must be made for them through radical belonging.
Working through this case made me realize, especially the part that I focused on was that the stress and fear among healthcare team members in marginalized communities is very real. This is something that hospitals and other healthcare companies need to pay more attention to and provide practical solutions to problems such as burnout and stress management. And the best way to go about this is to get input from all team members from all professions, which is what this presentation allowed us to do.
So I've realized that effective teamwork requires all members to be on the same page with their goals and to be transparent with each other about their personal priorities. That way, with this open and honest communication, people are able to understand each other better, understand where other people are coming from, and that way they can help each other achieve their best outcomes. And also by working through this case topic, I've also come to realize that in big organizations, in order to make positive change, interventions must come from all levels of the organization. And it does not make sense, or it's not fair to blame just one party.
I learned during this presentation that there are so many aspects that can go into creating radical belonging and effective teamwork within the healthcare setting. It is important to establish these implementations early on in any setting, but particularly healthcare, since we are usually dealing with life and death situations and people's lives.
Kind of comparing my experience in this project to the hospital, I realized that interdisciplinary work, it kind of on the hospital side has really so far for me involved just sending chat messages or getting updates on patients or asking questions to a certain team member. But working through this case has really helped me see that our interdisciplinary team on this proposal kind of made me reflect on how each team member's skills and responsibilities within the healthcare team are unique. And then in talking more about burnout as well, I realized that it can become difficult when someone is experiencing burnout to appreciate the skills of other team members, which ultimately just worsens communication and satisfaction and leads to further burnout.
So from this experience of working through this case as a team, I've been able to have a better understanding about the concerns and communication that can be discussed throughout the different professions. It has helped provide a little insight about what goes on in the workplace and in the future for each of us and what is happening in healthcare today. Hopefully, with being able to think of big ideas and improve on some issues that are going on through this case, we as healthcare professionals will be able to make an impact later on.
All right, that is our presentation. Thank you for listening.